Osteoarthritis is the most common form of arthritis and is the most prevalent form of adult chronic pain and long-term disability.
Normally, the symptoms of the disease is pain and difficulties to mobility. And we don't know exactly the factors because the pathogeny of the disease is very complicated, but we know some factors, genetic factors, another overweight. The gender issue is very important because it's most prevalent in women than men. We know that especially when the woman arrives to the menopause, the prevalence increases a lot. Also, there are other important issues that, for example, the sport is good, but the high level of competition of the sport could be very bad for the joints.
Participating in certain sports completely at an elite level can have a higher risk. We can have a higher risk to develop osteoarthritis later in life. For example, those sports that put an extra stress in our joints, for example, soccer, American football, long distance running, basketball, handball, have this type of sports. The people that practice them do have a higher risk to develop osteoarthritis. Also, the people that practice sport at an elite level have a higher risk compared to those that practice sport in an amateur level or that do not practice any type of sport.
And it's very important that to avoid lesions, because the lesions they produce osteoarthritis, like for example some problems of the joints. They can produce osteoarthritis, and we see young people with prostheses. That means that the sports is very important to take care about that.
For example, the ankle, the knee, and also the hip are the most common joints to have an injury. So we can develop osteoarthritis later in life in these joints.
The most common injuries in athletes are muscle and tendon injuries. Muscle is generally more acute injury, and tendinopathy, rupture of the tendon are normally more chronic injury. Tendon injury has very similar characteristics as cartilage damage. For this reason, we need to increase our knowledge about the tendinopathy, tendon ruptures, and cartilage damage, and at the same time, osteoarthritis. It's very interesting to know that these two pathologies, tendinopathies and cartilage damage, have some common causes. And at the same time, I think that it's important to know that the problem of both disease is the extracellular matrix problem. And as you know, these two tissues are component by collagen. Collagen type 1 in tendon, collagen type 2 in cartilage. Probably in terms of muscle injuries, today we have the opportunity to have a good diagnosis, to have a good treatments. Maybe today there are a big challenges in order to know how to achieve the best preventive strategies. But in terms of the tendinopathies and in cartilage damage, we really have a big problem because there are some treatments that are not successful. For this reason, we are thinking of for the new treatments in order to improve these kind of injuries. We need treatments that finally produce an authentic healing repair of this tissue.
So the TriAnkle project is an European-funded project with 6 million euros, and the goal of the project is to develop new solutions for cartilage and tendon repair with a special focus on elite athletes and active aging population.
We believe that regenerative treatment is the future. And that means that we believe that cells probably with the support of some growth factors and also with the support of some scaffolds, we will be great in order to contribute to regenerate this kind of tissues.
Regenerative medicine is a fascinating and rapidly growing discipline which looks to understand the body's ability to heal. The body naturally has an ability to heal, but with diseases, age, amongst other things, this ability reduces. And regenerative medicine is looking to understand how to unlock that ability, how to restore functionality and repair tissues and organs, and thus create a much better quality of life. Regenerative medicine is unique in the facet that it can be truly personalized. It can look to understand an individual's condition and provide a treatment pathway that is best suited for that patient and thus lead to a better outcome. It's also great because it's not looking to solve a problem with a specific drug or treat a specific symptom, but is looking to restore the functionality of the original tissue. Cell therapies are an important tool within the world of regenerative medicine. Simply put, cell therapy is where the active component of a treatment pathway is a cell as opposed to an antibody or a compound. These cells can be modified or not. They can be autologous, which means that they are taken directly from the patient, or allogenic, which means they can be taken from a donor. And these cells are then given to the patient in various different forms with the idea that they will help restore function of specific tissues. Most common example of cell therapy today that's known around the world is CAR T-cell therapy, which is where cells are genetically engineered or immune cells are genetically engineered to target cancer and destroy the cancerous cells. Another very common example of cell therapy is plasma-rich or platelet-rich plasma therapy, so PRP therapies. And this is a growing therapeutic pathway in cases where cell reproduction is required, given the very naturally occurring growth factors that exist in plasma.
Well, growth factors are proteins and they act like messengers, and they tell the cells what to do to multiply, for example, or to become very specialized.
Growth factors are essential proteins that are very important in the body. Actually, they are able to talk to cells and make them migrate, proliferate, differentiate, and they can also induce angiogenesis, which means that some of them can even try to ask the cells to make new blood vessels from the existing ones. So from a clinical point of view, in a general point of view, they can be very useful for regenerative medicine and also for improving the healing processes. And then if we talk specifically on the TriAnkle project, where we want to regenerate tendon and cartilage, here we choose them from all those factors, just 4. 2 of them have been selected because they have a very general effect on the body, so they can be used for treating different injuries. So that means that we are assuring a good oxygen supply and also nutrient supply, and we are able to deliver healing factors as well as regenerative cells to the place that we want them to go. Then another factor, one of those general factors that we have chosen is PDGF. PDGF has a very complete different effect. It's a very chemoattractant protein, which means that it calls the cells to go to the place that we want. Cells such as macrophages, also mesenchymal stem cells, for example, we go to the place that we put the factor, and we'll try to regenerate the tissue. So that's very important for both tendon and cartilage. And then for the specific treatment of the tendon, we have chosen TGF, which is another protein that acts on mesenchymal stem cells and will induce the differentiation of these cells into tenocytes, which are the cells that are in charge of the functioning of the tendon. So with this approach, what we want is to have a very oriented tendon, very functional tendon with enough strength and elasticity. And finally, for the cartilage, we chosen another one, BMP2 factor, which helps the mesenchymal stem cell to differentiate to cartilage cells, to chondrocytes. In this case, what we want is to reduce the symptoms of the osteoarthritis and also to improve the recovery of the osteochondral injuries.
They are very delicate, these growth factors, and they can decay in the body very easily. And so you create a bubble around these growth factors that protects them for these circumstances.
Well, these growth factors have tremendous effect on our body, that's true, but they are very labile, which means that they are degraded very fast by hydrolytic proteins. So this complicates a little bit the therapy if we use them in a naked way. That's why we put them into very small nanoparticles that can be done on different materials. They can be polymeric, they can be lipid-based nanoparticles. These nanoparticles give us three main advantages. The first one is protection, for sure. So when we put the factor inside those nanoparticles, we protect them from degradation, and therefore the effect of the factor will last for longer. And that's very good for the therapy, obviously. And then another advantages of this encapsulation technique is that we control the delivery, which means if we put the growth factors themselves on the body, they will have a peak, like a very high concentration, and they will act on the body, but then the effect will be lost in very short time. And the third advantage is the viability. This means that we are getting the factor just in the place that we want it. Because if we wouldn't put it inside the nanoparticles, the factor will diffuse to other tissues, to other organs, and the risk of this is to have side effects, important side effects. However, if we put this factor inside the nanoparticles, and even more like in TriAnkle, that we are putting the nanoparticles inside the biomaterial that then will be printed, then we are sure that the effect of the factor will be just on place.
This is really a great challenge for the future. But the future is here.